Hello everyone, welcome to Dental Mate. Today in this video we'll be talking about D-dimer test. So let's get started. So first of all, if we see or if you remember, if you have watched the video of lab diagnosis, we know that the normal range of D-dimer in human body is less than 500 nanograms per milliliter, whereas in COVID-19 patients it increases to more than 1000 nanograms per milliliter. Okay, so basically, what is D-dimer? If we consider a normal blood vessel and there is a cut in this blood vessel, the blood starts oozing out. Then what happens is there is clot formation taking place. Okay, so to cope up with the blood loss, the platelets and the clotting factors, they are activated and a cross-link of the fibrin meshwork is formed, to which the platelets are added, hence clot is formed. So see, this D-dimer, it is a FDP, that is fibrin degradation product, a small protein fragment which is obtained after the blood clot is fibrinolized or degraded. Okay, so after this blood clot is which is formed, if this is degraded or fibrinolized, then a fibrin degradation product or D-dimer is formed. Okay, why is it called D-dimer? This is because two fragments of D are joined by a cross-link. See, these two fragments joined by a cross-link. So this is known as D-dimer. Now, after this cross-linked meshwork of the blood clot is degraded, then along with the D-dimer or the FDP, there are certain other FDPs or the fibrin degradation products also formed. Under normal conditions, this D-dimer is cleared, but under an abnormal condition, the D-dimer value is elevated. Okay? See, this is the fibrin meshwork. Okay? Cross-linking. Can you appreciate the cross-linking? These are two Ds, one E, cross-linked. After degradation, two Ds are joined together. So this is D-dimer. This is one meshwork or one fibrin component joined with meshwork and clot is formed. After degradation, these two Ds are joined together as a fibrin degradation product. So this is known as D-dimer. Now, the elevated D-dimer values are seen in excessive clot formation and degradation. Okay, since this is a fibrin degradation product, so there has to be excessive clot formation or there has to be excessive degradation of the clot. Okay, so this is most commonly seen in deep vein thrombosis or DVT, which can further lead to pulmonary embolism or PE. Also seen in liver disease, pregnancy, certain major surgeries, and trauma cases. Also infections, malignancies, etc. Now, how there is clot formation in thrombosis patients. See, we'll be basically discussing what are the differences in clot formation in normal conditions and in thrombosis. First of all, what happens is the blood vessels is damaged, because of which hemorrhage occurs or loss of blood. Now, to cope up with this blood loss, platelets and certain clotting factors, they are activated. The clotting factors form a fibrin meshwork to which the platelets are added. So this is what a physiological clot. Whereas in conditions such as thrombosis, what happens is there is an undamaged blood vessel. Can you appreciate here? We have an undamaged blood vessel forming a clot which is rich in lipids and other mediators. Okay? This is present in intima of the blood vessel and this is called as thrombus. But we must remember that this clot or this abnormal clot, it also stimulates platelets and clotting factors such that the clot formation is enhanced. So this is a thrombus, and because of the thrombus attracting the clotting factors and platelets towards it, we can see that the clot has enhanced. Certain risk factors such as atherosclerosis, obesity can increase thrombus formation. Now, if this clot further increases in size, what can happen? It can form emboli or embolus, which completely blocks up the capillaries and thereby the blood supply to other vital organs is also blocked. So, in conditions where there could be excessive thrombus or embolus formation, excessive degradation would be there in COVID-19 patients. So, increase in D-dimer levels is seen. But how is this clot dissolved? So, what happens is this is a blood vessel with a clot. An important mediator for dissolution of the clot is TPA, that is tissue plasminogen activator. This activates a precursor which is plasminogen, okay, and converts it to plasmin. See, tissue plasminogen activator has activated the plasminogen. This would now be converted into plasmin. Now plasmin is the clot dissolving substance. So this acts on the clot and produces D-dimer and other fibrin degradation product. Now when there is excessive dissolution of the clot, there is increase. So when do the doctors prescribe the D-dimer test, or what are the symptoms seen when the D-dimer test has to be done? When there is difficulty in breathing, there is chest pain, leg swelling, rapid heartbeat, persistent cough. So in these conditions, D-dimer test is usually prescribed. Now if we talk about the D-dimer values, then I have told you earlier also that the normal level is 500 nanograms per milliliter. If it is more than 500 nanograms per milliliter, then it indicates certain abnormality or pathology. We need to take into consideration rheumatoid factor before going for the D-dimer test. How to infer the D-dimer values? Now, if the D-dimer value is less than 500 nanograms per milliliter, we can say that there is no thrombus or embolus present in the patient. But if it is more than 500 nanograms per milliliter, then deep vein thrombosis or pulmonary embolism can be suspected. This has to be confirmed by CTPA, which is a pulmonary angiogram. So this is it about the D-dimer test. In the coming video, we'll be talking about the radiographic signs and symptoms seen in patients with COVID-19 disease. So stay tuned, keep visiting. Thank you.